So this video is going to look at psychological formulation. Again, you can see on the spec that it's actually named as a separate bullet point. So the use of psychological formulation in terms of how it understands the function of offending behaviour in the individual. Now, psychological formulation is a way of making sense of a person's difficulties by looking at their relationships, their biological and social circumstances, and their life events, and also how they've interpreted these events that have happened to them. Now, psychologists are often asked why an individual has committed a crime, and this might be part of the court process to decide if the individual is capable of committing the offence, and therefore help them to decide the risk of reoffending. Now, they'll often be asked similar questions when working with offenders afterwards, after they've been convicted, and usually this is to help decide if the individual is safe to be released into the community, if they were given a prison sentence, for example. Now, psychologists might also undertake a psychological formulation to assess what influenced an offender's behaviour and to be able to ensure the chance of that future similar offending is minimal. Now, this is a way of making sense of a person's difficulties. So they might look at their relationships, their biological and social circumstances, and how they've interpreted life events. So it's almost like getting a personal story of the offender so that the psychologist can understand how it all links together and therefore how it resulted in offending. Now, this formulation will draw on all relevant psychological theories in order to be able to understand that behaviour. And actually, any psychological treatment is based on a formulation. So where the treatment aims to support the offender are therefore developed. So for example, the formulation might suggest at the end that an anger management treatment programme is the most appropriate for that offender in that given situation. So it's a really useful tool to inform the treatment as well. Now, psychologists basically take these psychological formulations that differ from each other, and for offenders, they're entirely individualised. There's not necessarily one fixed way of undertaking this formulation. The BPS, the British Psychological Psychology, has actually issued guidance that helps to reduce the variability and try and make them a little bit more reliable. And actually, the HCPC guidelines, so the Health and Care Professionals Council, actually support this guidance in how to undertake a psychological formulation. So you can see an example of a psychological formulation on the screen now. Now, other formulations might be much more complex than this or much more simple, depending on the different factors that are considered to be relevant to the offender and to their crime at the time. But this formulation can show how an individual hit someone in a pub and how their thoughts, feelings and physical symptoms kind of affected what they did at the time. So the individual, for example, received a criminal conviction for assaulting a person in a pub. Now, this formulation shows some of the background factors that may have been influencing the individual's decision to hit the person in that specific moment, including the fact that some of their triggers may have been present in the situation. So you can see here I've listed alcohol and a crowded place. Now, they may have felt a little bit out of control. The size of the person who threw the drink may have also been a factor. Their early experiences suggest that this person has been brought up to use violence to deal with situations rather than talking about them, and therefore this situation may have triggered past memories of being bullied when they were younger. You can see that the individual's core beliefs, which are the thoughts that drive our behaviour, suggest that it's important for him to make sure that people don't take advantage of them. And again, this is likely to be identified as driven by past experiences, possibly within the family or due to being bullied. There is someone who believes that violence is a way to resolve situations. So all of these thoughts are likely to have influenced the individual's decision to hit the person and throw the drink over them. Psychological formulation has not yet been on an exam paper. This is a question that was within the SAMs. So assess the use of psychological formulation to understand the function of offending behaviour in the individual for 8 marks. You can see here that the accepted AO1 is actually relatively quite basic. It's this idea of outlining the 4 aims that I had on the first slide. So psychological formulations are saying how a criminal behaviour can develop and maybe why it's maintained. It looks at the past and present, life events, social circumstances, etc. So this idea of complex problems in order to be able to help inform a treatment. And also this highlighting the idea that it's part of a court process in order to help us to understand how likely an offender is to reoffend. In terms of the evidence for psychological formulation, the AO3 is quite strongly based on that. So you can see here the reference to Mr. C, which is a case formulation that did actually work because it helped Mr. C to work toward goals that were valued to him. It's also this idea of case formulation taking a holistic view of a person and how that can be really successful. because it looks at therapies and treatments that involve lots of different ranges of things that will have informed the behaviour in the first place, rather than looking at one, say, biological aspect and trying to treat that while ignoring the other factors. But it's also highlighting the weaknesses of a psychological formulation and how difficult it can be to come up with a treatment for an offender when there's lots of data that may contradict itself. But also this idea that there are lots of people that will play a part in creating a case formulation. It's often done within multi-agencies across the court setting, and actually how that can then therefore make it really difficult to implement. And obviously this idea that anybody that would lead on this needs to be trained, and that can be quite difficult and cost effective as well.